Good evening. Welcome back to the Ask Me Anything with Dr. Twyman. So, a little bit of housekeeping to start. If this is your first time, I've been on Instagram for about 5 years since I launched my practice of cardiology. I practice preventative cardiology. It's probably the best term. I try to help people not have heart attacks. Used to be more of a invasive cardiologist, a little bit more reactive at that point. Got more proactive a few years ago, and really try to get at the root cause of why people have vascular disease and help them reverse those risk factors so that they don't end up in the cath lab, meeting myself or my former colleagues. So, been enjoying doing that, been growing my practice with my amazing team, and been doing these Instagrams on Monday nights at 6 p.m. Ever since the pandemic, just to help educate people about their vascular health. So, welcome to those that this is the first time. Welcome back for those that have been here with me before. So, a few things at the beginning. One, I will be having a kind of a retreat at the Canyon Ranch in October and November of this year. The dates are going to be October 31st through November 2nd. Still working with the Canyon Ranch team to iron out some details on the pricing and how to go about scheduling. There's no cost from my end. You would just pay your travel expenses to get there, and there'd be opportunities to meet up with me, maybe go on some hikes, meet me up for some meals and such, and kind of to see what I do to kind of optimize my well-being and health. If you're interested in potentially attending, I will send an email in the next week or two once I have more details from the Canyon Ranch. If you go to my website, drtwyman.com/retreat, there's just a button to provide some information to be contacted once more details are released. And I will also always share more information in these Instagram stories. The second piece of information is that my podcast with Dr. Lyon is supposed to drop tomorrow. It's going to be an excellent one in my mind. We'll be talking about GLP-1s and cardiovascular disease, talking about testosterone and vascular health, talking about the endothelial glycocalyx and nitric oxide, my area of expertise. So once the link is released, I'll put it in my story, but if you follow me anywhere else, I'll be sharing information about it as well. And potentially I'll do like a watch party in a week or two where if you want to watch the episode with me, I can walk you through kind of the behind the scenes and we can do an Ask Me Anything specifically about the episode. I will be still allowing some kind of ability to work with me one-on-one. I just don't know how long that's going to be. My practice is getting pretty full at this time, so I suspect my practice will probably fill up sometime in 2025. At this time, it's just myself and 2 team members. I see every single patient. Patients work with me one-on-one directly, and we do 2-part deep dives for initial patients, and then generally every patient who decides to stay with us sees us every 4 to 6 months after that point. So before the Dr. Lyon podcast drops and I get a bunch of inflows of applications, if you're really interested in working with me, get your application in sooner than later. My website, drtwyman.com, has the application up at the top corner. For those that ultimately are going to be able to work with me one-on-one or choose not to, I am working on an educational resource through the school platform, school with a K. Probably the soft launch is probably now. The hard launch will be Apollo Cardiology's birthday, August 1st, where the practice will be 6 years old. But if you're potentially looking for a sneak peek, if you go to school, which is skool.com/my name, like Instagram, DRTWYMAN, there's a current 7-day free trial. And then after that, it will be $20 a month. But I'm going to be doing more in-depth Instagram, kind of Ask Me Anythings and that. I will be doing these watch parties. I already have 3 courses set up there talking about how to interpret your own labs. I have a podcast there that is my top 30 podcasts summarized in 15 minutes. So I'm going to be adding a lot more resources in this school group eventually. So it's just getting launched basically tonight. You're the first people to hear about it. So if you're interested, school.com/Dr. Twyman, free 7-day membership. You should check it out, but give me a little bit of time. It's going to go live August 1st. And with that being said, we'll jump into the questions tonight. So for those, again, that are new, questions are submitted through my story. I put a story up early in the morning with a box, submit your question, and if it's on point with what we talk about here, I'll answer for you. If you're joining live and want to drop it in the comments, I answer those after I answer the pre-submitted questions. So we'll jump on in. So first question is small vessel disease in the brain and heart disease related. They definitely can be. You have nearly 60,000 miles of blood vessels. What's good for the heart is good for the brain. The lining of the arteries is called the glycocalyx. It's a protective gel coat, and underneath that's the endothelium. If those layers are healthy, you don't develop vascular disease in either of those organs, the heart or brain. But if you're getting microvascular disease findings, usually picked up incidentally on a brain MRI, that can be a sign that you have high blood pressure or that you have significant vascular inflammation or dyslipidemia causing small vessel disease. So look for things that affect nitric oxide, look for oxidative stress and inflammation, and then look at your lipoproteins, particularly your ApoB lipoproteins. It says, my thoughts on women's bioidentical hormone replacement therapy after menopause and its role in managing cholesterol. I work with many women who elect to go on hormone replacement therapy. It is something that is beneficial for bone health, brain health. It will have some effect on the lipoproteins. As you naturally lose estrogen through perimenopause and menopause, the LDL receptors get downregulated. The LDL receptors sit on the outside of the liver. I think it was like docking stations that grab the cholesterol particles out of the circulation and deliver them to the liver to be sent through the GI system to the gut and out the system. With the loss of estrogen, those receptors are less. You didn't have higher LDL particles after that point. When people go on hormone therapy, sometimes your levels go back down to where they were before. Not always, but if not, there are multiple agents that potentially can lower the ApoB to where you need. But you want to think about the artery themselves, not just your cholesterol. So any menopausal woman should have had a CT coronary calcium score at some point. Ideally, look for hard plaque in the coronary arteries. You could also do a CT angiogram if you have those available to look for soft plaque. And then I often recommend people start with a CIMT scan if they have access to it. It's an ultrasound of the carotid arteries looking for inflammation and plaque in those territories. If you have plaque in that territory, very likely you may have plaque in your coronary arteries. So it can be beneficial, but not the only reason somebody should go on bioidentical hormones. Could digestive enzymes help lower cholesterol by improving digestion? Not likely. Dyslipidemia is majority of the time due to genetic abnormalities. You can usually figure it out by doing your ApoE genotype. And if you need to know more, you can look at the GB Insight panel, looks at over 120 different genes. You can also look at your polygenic risk scores, because rarely is it just one gene that affects your cholesterol. But digestive enzymes can be useful if you've had your gallbladder taken out, or if you kind of switch up your diet and you're eating a higher fat diet and having difficulty breaking down that fat, digestive enzymes can make that a little bit easier, but should not have a significant effect on your lipid profile. Somebody says they don't have a question today, but would like to thank me for doing these Monday AMAs. Well, you're very welcome. I love doing them. Love to educate, hopefully somewhat entertain at times. But these are questions I get asked all the time by my patients and when I'm on podcast. So this is always kind of good for me to practice some of these questions. And for some of you who've not heard my content before, get exposed. And if it's interesting, dive down one of my 2-hour-long podcasts. What are my thoughts on omega-3s causing arterial fibrillation? So I would say atrial fibrillation is something that is more common as people age, but there are always these headline trials that say fish oil supplements cause AFib. I would like to see more details on it, but oftentimes it's observational data. It is not a randomized controlled trial that half the patients got fish oil, half didn't. It's more just asking people dietary history, like how many times did you take fish oil supplements in the past year? And then the people who had AFib, they say, well, maybe it is something associated with that. It is not a causative thing. It's just an association. So they would have to do further research to prove that it's in fact. But theologically, it does not make sense. Oftentimes, people who eat the most seafood have the less heart rhythms. So my concern with these trials would be that, in part, what type of omega-3 supplementation are you using? Because if you're using something that's already rancid, oxidized, full of fillers, you're probably not going to get a benefit. So you want to use a high quality product that is free of contaminants, heavy metals, and such. There's only a couple over-the-counter brands I've recommended. I always work with my patients to source it from a good location. Quick side note, be very, very careful ordering any supplements off Amazon. There are a lot of, let's just say, frauds and ones that are just absolutely fake on Amazon. So when I work with somebody who has a very reputable source, generally, a healthcare provider should have a reputable source to point you towards. But if you're eating the seafood, I'd have no concern. If you're supplementing fish oil, got to be careful. Sources matter. And then often do blood work to see where your EPA and DHA levels are on any type of supplementation. What are my best ideas for dealing with cellular inflammation? So from a quantum biology standpoint, think of it as too many protons, not enough electrons. In English, grounding, earthing to get more electrons. Sun exposure to get light to charge separate the water that's in your body. You can also do that with infrared saunas. There is some component of photobiomodulation that can do that as well. So we'd start there. But looking at extensive blood work to figure out, is it an autoimmune issue? Do you have Hashimoto's? Do you have high oxidative stress? Are you insulin resistant? Figure out the root cause will generally help you figure out what's the best way to treat the inflammation. But grounding, earthing, and proper sun exposure are the two key things I would start with. Somebody asked tonight, how can they lower the LDL? They say, sorry if you've answered the question before. No worries. I answer this question every day for the past 20 years. So it's something I'm pretty talented at being able to educate people on. So first off, always think about what is the health of your arteries. If you have plaque in your arteries, or if you had a cardiac event, a heart attack, a stroke, you got a stent, you got bypass surgery, you're probably going to want to modulate your lipoproteins so that you don't have that happen again. But it's more than just your LDL cholesterol. It's the lipoproteins. It's what transports the cholesterol that you need to look for. Those are the LDL particles. On the outside of the LDL particles is something called ApoB. So the analogy I use in my office is the LDL particle is a tennis ball, and that fills up full of cholesterol, triglycerides, different vitamins, and phospholipids. And then on the outside of the tennis ball is the white stripe. That's what ApoB is. The structural protein that holds that thing as a sphere, and then also acts as a key to bind to different receptors. So you want to count up how many LDL particles you have and how much ApoB you have. If you have a lot more ApoB than you would expect, you may have high VLDL or LPA, but that gets a little bit into the weeds, and you can better understand when you look at a blood panel to show you what we're talking about. But how do you lower it? Well, generally it depends, what levels you're starting with. Dietary interventions, exercise have a role, but they're probably minimal for most people. If you're really going to lower it, you're going to consider some type of pharmaceutical or nutraceutical. Sometimes nutraceuticals work for people, but again, treat the arteries, don't treat just the numbers. If you've had a heart attack or stent, you need to consider the big boy medications, statins, ezetimibe, PCSK9 inhibitors, Nexletol, because of the outcome data. People who take those medicines have less events. Supplements may lower your lipids, never been shown to have outcome data. So it's in your hands. So you got to work one-on-one with the person that, is sitting in front of you. But if you're really concerned about dying early of a heart attack, take the stuff that you know works for sure. Why does maximum heart rate decrease with age? The conduction system is aging, so the wiring doesn't fire as fast with the action potential, so that's why the heart rate tends to slow down as people age. That being said, the people who exercise, may have a higher resting heart rate. I should say can get the heart rate still up more than they're predicted. The old 220 minus your age is your maximal heart rate. It's a starting point. But if you're somebody who's very fit from an early point in life, you generally can kind of be higher than that number. When I freshly got out of the Navy, 220 minus the age, I was a little over, let's see, I was 33 when I got out of the Navy. So, my maximal predicted heart rate would have been like 187. I did a stress test on myself when I was in my cardiovascular training because it was a slow day and just wanted to see what I could do. I got my heart rate up to 205. I felt like I was going to pass out, so I stopped the test. But if you're more fit than the average, you can get your heart rate up. So wouldn't be terribly concerned if your heart rate's slowing down as you age. It would be more concerned if it's causing you to have exercise intolerance or you're actually getting lightheaded, dizzy, or passing out. All right. So, question: any data that free testosterone higher than the reference range can trigger atrial fibrillation episodes in patients with paroxysmal AFib? This is possible. The Traverse trial had shown with topical testosterone that there was an increased risk of atrial fibrillation in certain populations of men. So if you have an AFib history, you do need to be very careful with testosterone replacement therapy. Doesn't mean you cannot, but the key with AFib is modulating the stroke risk. So if you have other risk factors, high blood pressure, diabetes, prior stroke, your risk factors are relatively high on your vascular, you're going to have to consider anticoagulation to reduce that stroke risk. And then it's the pros and cons of how many episodes of AFib would you have if you're on testosterone replacement therapy. All right. So those were the pre-submitted questions tonight. Thank you as always for submitting some good ones. Now we'll jump into any of the comments here. So question says, can PMS affect blood pressure? Person tends to get surges before the cycle. Absolutely. As your estrogen levels change, you get different levels of nitric oxide released. Nitric oxide is a vasodilator. So if your nitric oxide levels are lower around those times, blood pressure may be elevated. If you also have significant kind of water retention, can vasodilate the arteries, affect aldosterone, potentially in sodium levels. Or if you have a lot of like cramping, just the adrenaline from the pain can constrict the arteries. So definitely is possible. Have I heard of losartan causing a stuffy nose and dizziness, vertigo? I have. And not common though. So if somebody can't tolerate an angiotensin receptor blocker and they don't have an allergy to ACE inhibitors due to angioedema or swelling of the lips or coughing, then potentially switch from an angiotensin receptor blocker to an ACE inhibitor or use a different type of angiotensin receptor blocker other than losartan. So question, what are my thoughts on red yeast rice as opposed to a statin? The short answer is that red yeast rice in other countries is marketed as a statin, so it's not as potent as the highest potency statins like Livalo, rosuvastatin, or atorvastatin, but it blocks the same enzyme, HMG coreductase. So it usually depends. If people have been on red yeast rice for years, no side effects, and tolerating it, and their apolipoproteins are at goal, I'll leave them alone. But I have not started red yeast rice on a patient in many years because it's always a challenge with this because you have to make sure you have a good brand. There's some brands in the past that had some fillers in them that cause kidney failure in patients, and unknown where some of that filler came from. So you have to be very careful on the brands of red yeast rice. And if it's not very potent, you often have to take some other agent because rarely would it work alone for most patients. So if you're really going to affect lipoproteins and you're willing to take something for it, you can try. But if you're not going to goal within 3 to 4 months, you should be using something more potent. All right. So there's one question that's popped in. I'll answer it in a second as other people are kind of typing in. So just to kind of recap, we do these Ask Me Anythings every Monday, 6 p.m. Central Time. If you're ever looking for the archives, it'll be in my Instagram archives. But I do take every one of these images or videos that I can, run it through a AI system to kind of get a summary of it, and then post it up on my Dr. Twyman YouTube channel. My YouTube channel, the short link would just be Dr. Twyman, my name up here, .tv, and it'll take you to the YouTube channel. So that's where some of these videos will be. Also, some of my older long-form videos are there. I was telling people earlier, my patient kind of census is getting high. I'm still open to one-on-one patients. My practice is just myself and 2 great team members. But if you're potentially wanting to still work with me, I still do have availability, but I'd encourage you to apply now. My website is drtwyman.com. Reason I recommend that is that my podcast with Dr. Lyon is supposed to be released tomorrow, and it's going to get a lot of attention. And I'm expecting a lot of influx of people who want to work with myself and my team. So I will get through the applications as fast as I can, but bear with us. It's just myself and 2 people on my team. We've taken care of patients from, I think over 35 states at this point and 6-7 different countries, as far away as Australia. So, we're happy to work with people, but we'll get to you as fast as we can get to you. For those that want to learn a little bit more than what these Ask Me Anythings are able to give you, listen to this podcast with Dr. Lyon. It's going to be very in-depth, but I've also started to put together a school community. This is going to ultimately replace my old Facebook group, which I've not been active in many years. The school group, it's in kind of beta mode right now. There can be a 7-day free trial if you're interested. It's school, spelled with a K, SKOOL.com/Dr. Twyman, as my name is spelled up there. And if you like it, there's going to be a kind of nominal fee going forward, but the full site's going to launch August 1st. In the interim, there's 3 courses that I put in there. And then I also have a podcast which I've summarized my top 30 podcasts. So you can take basically 60 hours of podcasting that I've done and listen to a good summary of it in 20 minutes or less. I also am working with the Canyon Ranch on a little bit more details on pricing for the retreat that will be October 31st through November 2nd. If you're interested in hanging out with me, maybe go on some hikes, go to get some meals, go to the biohacking lounge that they got, and want to just kind of meet me in person, that's the best way to probably do it. If you're interested, my website, again, drtwyman.com/retreat, has just a quick click, takes you to a couple question form just to get the contact information so that when I have more information with Canyon Ranch, I can directly message you with it. But I will always update in my stories when I have more information about the retreat or when my school community launches, or if I end up filling out my practice and saying no more patients at this point. But for Monday, going forward, I will still be here every 6 p.m. Central Time answering your questions. So I think there's another question that popped up, and I'll answer that one, and then I'll jump off and let you guys enjoy the rest of your night. So there was a question about any recommendations for cardiovascular risk reduction for a pilot. They have constant EMF exposure. I have quite a few patients who are in the same predicament in my practice. The EMFs will essentially cause voltage-gated calcium channels in your mitochondria to open. That causes oxidative stress and inflammation. The mitochondria don't make energy as efficiently, and you start aging faster than you want to. So the key is to try to do everything possible to recover after these flights. So getting good 7 to 8 hours of sleep, having a kind of EMF-free bedroom to make that happen as best as possible. I would recommend, looking at things that I talked about earlier that help, grounding and earthing to get electrons that way throughout the day. Infrared saunas, potentially cold plunges. And then there's a whole host of supplements, but I always need to know people's history, what they're currently taking, any allergies and stuff. So I don't usually list, what supplements or what meds I'd recommend off the bat. But this is one of those cases where, this is a high risk profession. There's definitely data that, pilots, flight attendants tend to have increased risk of certain cancers, and cardiovascular disease would not be surprising if they have higher risk as well. The EMFs can damage the glycocalyx of the lining of the arteries, cause inflammation in the lining of the arteries, and then plaque can be a consequence. So would recommend that people get their screenings done. 60,000 miles of blood vessels. Start with the carotid arteries. Look at an intimal medial thickness scan. If you're over the age of 35, ACT coronary calcium score should be 0. If it's 0, repeat in 3 years. If it's not 0, do the deep dive into some lab work to figure out why your score is not 0. CT angios are more sensitive, but higher financial cost, higher radiation cost. Worth it for some people, but not for everybody. And then working with somebody who understands the risk of EMFs in that population. So that's what I have for you guys tonight. I hope you enjoyed, and I'll be back next Monday, 6 p.m. Central Time.